Hello, everyone, and thanks for joining us for a very important discussion on a topic that is devastating our region. I am Harrisburg Police Commissioner Thomas Carter, and I am joined by other law enforcement officials and experts on what we are calling the opioid crisis. We are calling it a crisis because people are dying in record numbers from overdosing on painkillers and on dangerous drugs such as heroin. And the people who are dying come from every class, every race, every socioeconomic group. With me to discuss this special report on the opioid epidemic are key people who can help us understand what is happening and who's affected. First, may I introduce former Lancaster Police Chief, Chief Sadler. He is now Harrisburg Regional Director of the Attorney General's Bureau on Narcotics Investigation and Drug Control. Please also welcome Mr. Ray Barshinsky, Deputy Secretary for Health Preparedness and Community Protection for the Commonwealth of Pennsylvania. And Mr. Barshinsky is also the Incident Commander for Governor Wolf's Disaster Declaration for the opioid crisis. And then we have from Dauphin County, we are pleased to have with us John Spannyberger, Treatment Coordinator with the Dauphin County Drug and Alcohol Unit. Last but not least, as our own Deputy Chief, Derek Moody. Chief Moody and his officers deal with the opioid crisis every day in his work in protecting the people of Harrisburg. Before we start on the questions here, I would like to say that we do have a live studio audience. Thank you for joining us, audience, and you will have an opportunity to ask questions. Mr. Spannyberger, how do you view the opioid crisis, sir?
Well, the impact it has had on our society is tremendous. I've been doing this type of work for over 30 years, and I've gone through crises before. I remember the crack crisis that we had in the 80s, and this is totally unlike that. You would think that by now it would have started to wane a little bit. It may take a few lulls here and there, but it continues to be a strong, for want of a better term, crisis. It just seems to always be there. I believe every week, in the length of time I've been doing this, and especially in Dauphin County, every week I hear of somebody else overdosing and dying. And the tragedy of this crisis is just overwhelming, I think, to everybody, communities, families, children. It's just incredible, it really is.
Thank you for that, sir. But I just want to say that, as you mentioned, the county, so what you're saying that this is just not a Harrisburg problem. This is a regional and a national problem. Chief Sadler, your responsibility is with the state. You control a large part of the Attorney General's Drug Task Force. How do you see this?
Well, you're correct. I mean, this crosses all color lines, economic lines, county lines, city lines. The drug crisis knows literally no boundaries. I have almost 38 years experience in law enforcement, 27 in Philadelphia, 10 in Lancaster, and now one with the Attorney General's. And the gentleman said the crack epidemic we saw in the late 80s, there's been a lot of comparisons to that, but this crisis, I mean, just in the country alone for 2016, I believe there were almost 60,000 overdose deaths in the United States. Approximately 20,000 of those due to opioids. Pennsylvania in 2016 and 2017, each year probably logged close to 4,000, 5,000 overdose deaths just in the state of Pennsylvania. And in our region here in central PA, you have cities like Harrisburg, Lancaster City, Lebanon, York, and then all the surrounding communities that have clearly been affected by it. So I think the dangerous part about that, the fentanyl-driven opioid crisis and heroin, these are narcotics that have no medical use whatsoever. They're considered Schedule I narcotics in the Controlled Substance Act. So it's clearly something that it's not singularly anybody's problem.
We're going to get back to the fentanyl, as you mentioned, sir, but Mr. Barshinsky, you know, you're tasked with running the governor's task force on this, you know. Obviously, that means that we have a serious problem, you know. So can you tell me, you know, what you're doing about this here and how you view the crisis? Is it something that we can handle, or is it going to get worse before it gets better, sir?
It's a good question. So first, I want to agree with the other panelists here. This is a statewide issue. This is not something that's a local city, a region. This is impacting the Commonwealth, period. There are some estimates that we see 13 people a day die in the Commonwealth from an opioid overdose. And to put a finer point on the previous one that was made, in 2015 we had 3,300 in that area opioid overdoses. In 2016 this went up to in the area of 4,600, and in 2017 this was at 5,400. So in 2 years we went from 3,300 to over 5,400 overdoses. The governor recognized the crisis nature of this and declared a disaster in January of this year. And one of the first things that we had to do was to put together all of the state-level agencies that had any responsibilities in regard to this crisis. And we've done that, and we've moved forward on a lot of different initiatives in regard to the crisis. But to answer your direct question, this is a marathon. This is not a sprint. And there's no one strategy that's going to win it, just like there's no one entity that's going to win it either. This is going to be local, regional, and state level authorities listening to the national authorities and getting federal money. It's also going to be dealing with academics to figure out what we're studying and whether that's the correct thing to study. And it's also going to involve working with private industry as well. This is something we as a community, the Commonwealth as a community, need to wrap our hands around and realize there's no easy answer, but there is an answer.
That's very interesting, sir. A community tells me that this is affecting the young plus old, and we're going to get back to that there. Deputy Chief Moody, you basically deal with it every day with your people out there working the streets. Can you, just tell me, how many overdoses have we had in the city this year?
This year alone, and I brought some numbers with me just to make sure that I stay on track here. We have year to date, total overdoses are around 220 overdoses. And that's including fatals. We have about 39 on record right now, fatal overdoses in the city, which is a dramatic spike from what we saw this same time in 2017. So as it's stated previously, we're seeing that uptick. It's constantly moving up. It hasn't waned off. It hasn't hit that plateau, which is very concerning for us.
The opioid crisis really has no social economic group. It doesn't discriminate against race, color, or anything like that. How did we get here?
We got here, I believe, from a multitude of different avenues. Not one specific avenue took us there. A big piece of, I think, how anything becomes a crisis or a problem is education or lack of education, just not recognizing what you may have in front of you or see where it's taking you. I know we talked about just previously when we talked about the crack cocaine epidemic and kind of, what took us there, how we saw it rise and then level off with just some changing in enforcement and a couple of other different tactics that were used. This particular enemy that we're dealing with, we're not new to it. It existed before. It was big at one time before. It kind of just tucked away, kind of like a virus, it just gathered up strength and just came back at us much harder this time. So I'm not sure that the same tactics that we used last time with the crack epidemic was, which got us back in control there. I don't know that that's the same path that'll get us there this time. We're really going to have to come out of the box and hit it from every avenue.
And that's interesting comment, sir. Mr. Barshashinsky, realizing that we have unique people that are experiencing this opioid epidemic. We have people that were given opioids by their doctors because of injury. So we have a multitude of people affected by this. What is your take on that?
That's a great question. And so just picking up where you just left off, in the 90s we saw pain management or pain identification by healthcare providers really emerge. I believe some refer to it as the hidden vital sign or even the fifth vital sign. And pain management became a larger subspecialty. And what we saw were opioids, which at the time we thought were non-addictive or less addictive. And it turns out they weren't. And so we saw a lot of opioid prescriptions being written. And then in the, for lack of a better term, perfect storm, when people couldn't get any more prescriptions, they went to street drugs, like heroin. And so at that same time that we saw all of those prescriptions being written, we also saw street heroin become cheaper and more pure. So what you just described is exactly what occurred. And with those things occurring, we now are facing this crisis. And then one of the sub-issues here, Commissioner, is the fact that it doesn't only impact the person who has substance use disorder. It's impacting families. It's impacting neighborhoods. It's impacting the Commonwealth.
Okay. Thank you for that answer. Chief Sadler, let's talk about the heroin and the fentanyl
Sure.
mixed in the heroin that is causing a lot of the overdoses. There's a lot of competition out there for that theory, so that means that the price is driven down, so it's accessible to a lot more people. Can you explain, what your people are trying to do about that to combat that problem?
Well, like was previously stated, heroin, which has no medical use, actually the opioids do have a medical use, but the abuse of that is pretty much caused where we are now. You're right. What happens when heroin used to be considered probably by the mid to late 80s as old person's drug, people would say, oh, nobody does heroin anymore. Cocaine was what most people were abusing back then. However, the dealers realized that when they were cutting heroin, that they could cut out the middleman and just put it right out almost in its purest sense. The heroin 40 years ago might have been 5% potent, 10% at the most. And now, depending on where you're buying it, it could be upwards to 94% pure, which of course, even though a lot of data shows there's less people addicted to certain drugs, the people that are addicted, it's a much more powerful narcotic that they're getting, which causes that addiction. Same thing here. What a lot of traditional heroin users might be buying something that's fentanyl, and fentanyl is literally can be upwards to 50 to 100 times more potent than heroin and morphine. So somebody that's a heroin user gets a hit of fentanyl. I mean, that's why you see sometimes somebody that's, you'll talk to family and say, well, he's been addicted for years, and then all of a sudden they're dead. So, literally people that are buying drugs out in the street, most of the time they have no idea what they're getting. Sometimes people might even think they're buying cocaine, and it might be laced with fentanyl, or it just might be pure fentanyl. So, I mean, it's an obstacle that's very difficult to overcome, because somebody purchased drugs and they have an addiction, they don't whip out a fancy test kit and see what they're really getting. And in some cases, even when the warnings are put out by local law enforcement, when there's a bad batch of whatever out there, fentanyl, sometimes that makes people that are addicted seek it out even more.
Thank you for that. Mrs. Sponnyberg, and now we have this here monster on our backs. We have this here opioid crisis, and with the opioid crisis comes crime. There's a spike in crime, and you're there to treat that person who was in the courtrooms to be sentenced by the judges. Can you explain to the audience, to the panel, what your job actually is, sir?
Well, what we do, about 2.5 years ago, Governor Wolf talked with Gary Tennis, who then was the Secretary of Drug and Alcohol Programs, and out of that conversation developed a warm handoff. It was mandated for every county in the state to develop their own unit. Dauphin County Drug and Alcohol decided their unit would be an in-house unit. So I took over the supervision of that. And what that is and what that unit does, it responds to the overdoses at all the area hospitals. It keeps us rather busy. We in that unit don't respond just to opiate issues. We respond to everything in the ERs or people who have been admitted to the hospital. We also try to divert people from jail to treatment. We do that. Our office right now is located at the Dauphin County Judicial Center. So when people are brought to the center, we try to get people to open up about their drug use. It's a difficult thing for a lot of people because they're afraid of how that's going to work at arraignment and things like that. But we've had a good relationship with the magistrates in Dauphin County to listen to, let's get people into treatment rather than putting them in jail where nothing really is going to happen to them positive. We are working now with your support to develop a program with your officers as well to address that, and the emergency management systems in Dauphin County. We want to get people help. We don't want to just lock them up, and we don't want to leave them on the street to continue to do what they do. Opiate recovery is one of the most difficult ones. People that are addicted to heroin have one of the most difficult times at maintaining recovery. It's the nature of the drug.
Thank you. Chief Moody, what's scary to me is that we know that, just speaking for Harrisburg City Police, that we respond to a certain number of calls for overdoses. But the real scare is that, we have emergency medical units coming into the city or outside the city, bringing people in. Do we have any real idea of what that number is?
That's a hard target to hit, especially considering how many different entities are involved in it. Speaking from strictly a city standpoint, we track our own numbers. We keep track of the obvious signs. A lot of times what we tend to see are the calls that come into the dispatch center. They're not always dispatched as an overdose. It could come in as cardiac arrest or a breathing problem. That's usually a large chunk of the calls come in as a medical assist. Fortunately for us, county dispatch tells us when they're dispatching to a particular call. So I think a big portion of that now, from at least the police standpoint in the city, is that we hear them. Well, our ears are kind of tuned now. You're waiting for the next piece to come and say, oh, this is an overdose, or no, this is a truly medical issue. Now, those are the ones that we know about now. If someone self-transports down to the hospital, or if EMS is dispatched and police, for whatever reason, don't know about it, we won't have those numbers. But Harrisburg Hospital services a lot of different communities, not just the city of Harrisburg. So something that may happen in Lower Paxton, and believe me, it happens everywhere else across the river, they can come into the city and we wouldn't capture that number. I think the hospitals, and probably if you could pool all of the EMS providers, that would give you probably a better snapshot of the bigger problem. But with HIPAA laws and everything else, that's kind of a protected piece of information that's not really flowed out too well. We talk about this being an educational piece, and that's part of the breakdown, is the lack of education or what's really going on. So that's a piece that we'll have to deal with.
And that's very interesting, the educational piece, because a lot of times when an overdose comes in from outside the city, and if they expire inside the city at the hospital,
that's ours.
That counts as a Harrisburg death. And I think that people should understand that. And not only that, Harrisburg is a younger agency with a lot of newer officers. Can you tell the audience, what impact that has on your officers? What are you seeing with the officers? How are they feeling? They're being asked to perform things that police officers aren't usually doing. 20 years ago, we didn't, have things to bring people back. The Narcan, for instance, How do the officers feel about doing that?
Well, the mission has definitely changed from a time from when I came on in the early 90s to now. Police officers in general everywhere are tasked with do more, do more. It's always a do more. And I think it's important for people to understand, particularly in cases like this, when we get to the opioids and a lot of the other bigger issues, By the time it's gotten to the police department, it's passed through a whole bunch of other tiers, and it's failed in quite a few different places. What it's left with by the time we get to us is everything is expired. Everyone is pushed to their limit. There's no quick answer, and it falls to police. Where you see the issue for the young officers, police officers in general, and I think I can speak for probably 95 to 99% of police officers, come into this profession with the mindset that I'm here to help people. We don't get to pick and choose who we help and why we help them. It's the mindset is to help. So I think all young officers, regardless of their age, their time, where they've come from, the mindset is to help. The hard part is wrapping around you seeing the end piece to that help. Some of the things that we do, you can see, if I do this, this is the outcome. This is one of the few where no matter what you do, you're not sure of how that outcome is going to be with the recidivism rate that as high as it is.
Thank you. Mr. Barshinsky, would you say that the problem is any worse in this region here, or is it worse throughout the nation?
I think we're seeing pockets of areas where sometimes there are peaks and valleys. And I think even within the Commonwealth, we see some areas where sometimes it gets hit harder, and then other times it seems to kind of pull back or relax a little bit. I think that one of the most important issues to keep our eye on is the fact that this is our crisis. So we have a crisis here. We're trying to get to the deputy's point. We're trying to get as much naloxone out there as we possibly can. Last year, the governor gave the Pennsylvania Commission on Crime and Delinquency $5 million to purchase naloxone for both traditional and non-traditional first responders. And to date, that naloxone has reversed nearly 3,000 opioid overdoses. So what's interesting is we need to kind of focus on where the crisis is, focus on victories, so that way we're letting people know what we're doing, and then focus on those patients who need us, reversing them with naloxone, getting them into an ambulance, getting them to the warm handoff that you specifically mentioned, getting them to the hospital, and getting them to treatment. We can't get them anywhere if they're dead.
And you touched on my next question. I was going to ask, how does the usage of Narcan affect the actual overdose deaths locally?
You hit the nail right on the head with that. We've discussed this amongst ourselves in our command element at the police department. The successes that we have are dependent upon getting to the people in time. You know, the people that overdose, that we get the phone call that this is going on right now, we have a higher success rate when we can get there, administer the Narcan. And in this particular case, I mean, with the introduction of fentanyl and all of the other mixtures that we deal with now, I know John and I talked about just the K2 spice, the synthetics. You know, hard part is just figuring out from the door, what am I dealing with? What drug am I dealing with? Number one, and then the ability to provide that particular correct treatment. If we can get to them quick enough, if we can administer the Narcan, in some cases 2, 3 doses to sit the person up, if we can get them into the bus for EMS and get them to the hospitals, their success rate is very high. You know, the problems that we see even in the city is, hey, this person's been laying in the backyard somewhere for goodness knows how long. You know, and that's a key piece, is actually getting there in time to provide those services.
Chief Sadler, what percentage of addicts would you say relapse and go back into using opioids?
Well, I know historically, even for rehabilitation, people that have that heavy addiction sometimes are not successful till the 6th, 7th, or 8th time through rehabilitation. And obviously, opioids that are so powerful and narcotic, that number may be higher. And then again, there's some people that never go to rehab, they never make it that far. Or maybe they are clean for a little while and they get right back into it. I would imagine at this point, you know, a lot of the rehabilitation centers are probably overloaded. I'm sure it has to do with funding as well, but if you take, speaking from, I mean, I worked in Philadelphia and Lancaster, and when you have somebody who's addicted, and even if they go to rehab, and they go right back to the neighborhood where it's easy for them to purchase narcotics. The temptation is too great for them.
Okay, thank you. Mr. Barshinsky, what would you suggest? I know that you talked about education, that there is always a big piece in any epidemic that you have. What would you suggest besides education to help stop the abuse of opioids?
So I think it's interesting. I think it's a multifaceted solution, and I will start off with education, and I apologize for that. I think that when we educate healthcare providers on some of the dangers of opioids and some of the dangers of addiction, that's a great first step. But engaging all of our other entities is probably one of the most important steps. I know I touched on that before with the governor's disaster declaration, but in the first disaster declaration, which was in January and it was for 90 days, we had 11 state-level agencies together. As the second disaster declaration took effect, which I think was the beginning of April, we realized there were certain entities that we didn't think about the first time around. The Office of the State Fire Commissioner, Military and Veterans Affairs. Those are two areas where we have a lot of vets coming back who need someone to speak to in regard to this. And in regard to the State Fire Commissioner, just like law enforcement and just like EMS, which we both mentioned, our fire departments are on the front lines, and in suburban, rural, and even some urban areas, they're the first responders. So including them it was part of our learning process, and it taught us that there's no simple solution, for lack of a better term. Even areas in the first disaster declaration that we thought we had closed the door on, those are still areas where we're still collecting data, where we're still keeping those initiatives going. And whether it's in regard to neonatal abstinence syndrome data, or whether it's in regard to our naloxone leave behind program, which allows EMS providers to leave naloxone behind after an opioid reversal, these are areas where we look at the solution and say, what are we not thinking of? And to that degree, right now we have an embedded researcher from one of the universities in Philadelphia, where he is working with the command center folks. We meet every Monday, and he works with the command center and says, this is the data that's working, but this is the data that you need to be looking at. Here's the focus. And the thing with this particular crisis is we have to keep our eye on the crisis, because the focus is always changing. It's not rural, it's not suburban, it's not urban, it's not African American, it's not white, it's everything. And that means we need to focus on everything and not lose that focus.
Thank you for that, and that's an interesting strategy, but what you're just saying, is that it's an all hands on deck situation, and we need everybody because, 20 years ago, the prescribers of opioids, they didn't realize what they were getting into because the study wasn't out there, so a lot of people, by no fault of their own, they got hooked on this medication and they turned to other means to get off of it.
Yes.
Okay, thank you for that, sir. Mr. Sponnyberger, how urgent is it for us to get this epidemic under control?
Every day is urgent to do that. Anytime another person dies, just as an example of the urgency to get this under control. And I believe everybody's working their hardest to do that. It's just a difficult thing to do. When you do get people addicted to this drug, it's a difficult thing to interrupt, no matter what we do. We've begun to use medication-assisted treatment a lot more now than we ever have. We use Vivitrol, the newest drug, Suboxone and Methadone, to give people a little bit more support in recovery so they aren't dealing with the constant obsession and craving to use. And it's been effective for most people that use it, but you have to use it. And a lot of times people are just drawn back to doing everything that they did before because there's nothing been given to them or provided to them to take its place. And especially who you hang with, where you live, unemployment and all those kinds of things. So we're able to work more collaboratively, and so we're making, I think, bigger strides now than we did a year ago because we're working with the police, we're working with the EMS, we're working with all the other county and city agencies to address this problem. So the urgency is a day at a time.
And I heard about the new medication that's coming out to fight this epidemic with, but there are other thoughts out there that's saying that you're just teasing the beast, you're just suppressing the beast. You're not really doing anything for the people hooked on that. What's your take on that, Chief Moody?
There's a couple different mindsets to that, and one, I do agree with what is being said here. You have to start somewhere. I don't know where that start is. I don't know what the best recommended start is, but I can tell you doing nothing is absolutely the wrong answer. So I don't criticize for starting somewhere. It's our ability to look at that in a timely manner and make adjustments, the correct adjustments, is, I think, is the challenge there, that we don't trip over ourselves and focus all in one spot. Obviously, any addiction or any problem that you can't handle your own, you should be looking at other resources to get you there. And if the resource is medication, I can see maybe some of the pitfalls, and I know, methadone, people can get hooked on methadone as a treatment for another problem. So there's always that balance that you need to be able to provide, and that's where I talk about just having that oversight and that ability to control that, because then next thing you know, your solution is now part of the problem as well.
Can I jump in on that, Commissioner?
Yes, you can. Go ahead, sir.
That was a good point. And in regard to medication-assisted treatment, I think I've got two additional facets that I tend to focus on. The first is that I definitely think if we're looking at a person with substance use disorder, it's better to have them treated by a physician in a healthcare setting, even if they're being treated with medication-assisted treatment. So there's more control over it. And so we have a physician who's, whether it's outpatient or inpatient, who's looking at that and saying, is this working, is this not working? How are they feeling? How are they reacting to it? And then the second thing is that we know what we're giving them. So whether it's Vivitrol, buprenorphine, or another medication, we know what we're giving them. We don't know what's out there on the street. We do know it's killing our people. So to me, medication-assisted treatment is a benefit, but I hear where you're coming from.
I wanted to ask the chief here to add, what his take is on the epidemic.
Traditionally, when you think about law enforcement of the legal sales of narcotics, you may have a vision of neighborhood kids standing on the corner selling cocaine, crack, heroin, whatever, marijuana. Things are much more sophisticated now, and including in that realm of people that are being proprietors of it are members of the medical profession. A large part of what the Attorney General's office does now is diversion, which investigates the medical profession. That's doctors, nurses, healthcare professionals, pharmacists. Now these are people traditionally that we trust. I mean, we all have family physicians. Unfortunately, there's a small percentage of that profession that has contributed to the problem on purpose. We're not talking about a doctor that does knee surgery and says, well, it's a very painful recovery, I'll prescribe 10 oxycodone pills and call it a day. We're talking about people in the medical profession that purposely are writing bad scripts, or pharmacists that are filling bad scripts.
Well, panel, thank you. This has been a very robust discussion. I want to open it up to the floor right now. So anybody in the audience that has questions, please come up to the microphone and ask your question.
I'm Reverend Nathaniel Gadsden, pastor of Romani African Christian Church here in Harrisburg. Real concerned about solutions. I know that there's a major epidemic out here and a crisis out here, but as a pastor and as someone that's a parent and just a concerned citizen, what do we do? So if we could focus just a little bit more on what's happening around the state or around the country that has actually worked or seems to have a promise for us, and if someone could answer that or give us some solutions, I'd appreciate it.
Mr. Barshinsky.
Certainly. Pastor, I want to make it clear, we have a lot of different strategies that work. Naloxone works as a medication, as a drug. Medication-assisted treatment works. We have a lot of recovery. We have centers of excellence here in the Commonwealth that work. Our warm handoff program, which I wish I remembered who highlighted it. I think it was you. Mm-hmm. Okay, I want to get that. I want to give props. Our warm handoff program works. We're seeing more people get into treatment than we've seen before. but we don't think we're winning. We're fighting it, though. We're winning on some fronts, but on other fronts, this is really difficult. And even if it means houses of worship mentioning the crisis on a Saturday sermon or a Sunday sermon, that works. When I said to the commissioner before that, we look at the state level agencies, and then we're bringing in academics, and then we even brought in private industry, bringing in religious groups. We need to fight this in any way it works. So if somebody will listen to you, you need to speak to them. If they've already overdosed and it's a law enforcement or an EMS issue where we have to get them in the lock zone, then that's what we have to do. But this is a war on multiple fronts, sir.
Thank you. Mr. Sponnyberger?
Well, I believe it's not just treatment that we provide for an individual, and I think that's been the approach for many years. Well, we send them to treatment and the rest is up to them. And I think that has been an ineffective and inadequate strategy to deal with this. What we're doing in our office is an individual goes to treatment, they're assigned a case manager, because what we want to do is look at their non-treatment needs, which I mentioned before. It's not only medication-assisted treatment, which for us needs to be done by a program that provides treatment at the same time, whether that's outpatient, intensive outpatient, or a partial program. And our case manager are looking at the non-treatment needs, like, do they need a job? Well, we're going to try to get them hooked up with agencies or programs that can help them get a job. Education, most of the folks need a GED, or they have the skills to be able to get a college or a technical school or things like that. Look at housing for them so that we're not putting people back in the same environment that supported the issue. I think the more we approach these things and with Reverend Gadsden to work with your program and other programs in the city to be able to help these individuals when they come out of treatment.
Thank you. More questions from the audience, please?
Good afternoon. I'm Evangelist Joyce Vanderhorst Gamble. I am from the Kingdom Warriors Outreach Ministry, and my question is there a program or something in the near future to educate our youngsters, because they need to know what is going on in regards to the opiates, to these drugs, and what they do to people. Because I deal with the daycare, and I come in contact with a lot of youth. And just because they have now got the weed where it's illegal, and they can, use it, they have it in their mind that it's legal for them to use it. But that's just as dangerous, even more so, because they use the weed, and then before you know it, they're into something harsh. So therefore, is there some plan where, as you're going to start talking to the elementary level, middle school level, and the high school level in regards to the effect on drugs?
That's a great question, because some of the past education programs clearly did not work. Young people, when a police officer stands in front of a crowd and says, hey, you kids don't do drugs, that just falls on deaf ears. The programs that have showed measured success usually involve, younger generation is visual, video games, everything is visual. When you see a picture of a high school prom queen at 17, and they show a picture of her 3 years later at 20, and she looks like she's 45 and near deaf, that has an impact. And when mothers and parents, grandparents of deceased children speak to a crowd, those young people actually pay more attention than any of us could probably garner from that. So, that's probably some of the things, and several places do have those.
I did see a program once, and I apologize, I can't remember the name, that the county put on, and I believe it was hosted by Dauphin County Juvenile Probation. And the audience was made up of youth, whether they were in trouble or not, but it walked them through a bunch of scenarios that wrapped around drug use, drug sales, and it took it from a different perspective, where they had actors that were young actors acting in front of the youth. It was a very positive approach to it, and to me, sitting there watching just the reaction of the youth that were involved, it seemed like it took hook, like they could relate to it and associate, because like you said, it wasn't just adults telling you don't do it.
Right.
They walked them through it. It was a very good program down at the center off of Cameron Street.
Thank you, sir. Next question from the audience.
My name is Said Onal. Like you said, this is a problem for all communities. My problem is I see a lot of families that are in denial or afraid, ashamed, or they don't know what to do. When do you think families should get involved, and how heavily? What's the family, I mean, what to do when you first suspect there's something going on?
I believe that you do it right away. You don't wait for anything. You call, and parents can always call our office to talk to somebody about how you address this, how you're going to follow this through. Because because of the nature of the drug and the possibility of overdose, delaying is not the thing to do. It's you have some concerns. We'll help you learn how to address those concerns. We'll help you get by that fear of bringing it up with your child or any other member of the household. I know it's a difficult thing, but I would rather do that at the beginning rather than hear somebody calling and say they lost their child. Hopefully that helps you. I get too many of those calls when people call and say, my son, daughter died. I don't know how people deal with that. I really don't.
Next question from the audience, please.
Good evening. My name is Nelba Wright, and I'm the health officer for the city of Harrisburg. First and foremost, I'd like to thank you all for your service. There's been a mention of many years of experience and different approaches to controlling this epidemic. And there's been a lot of discussion lately about the pharmaceutical industry and going after them, if you will, or having them play a very active role in education or prevention or control of access. So if anyone would like to speak to that, I'd like to know what the latest developments are.
Sure. Well, our Attorney General, Josh Shapiro, among many other state attorney generals throughout the country, are actively pursuing that on several levels, because certainly they have some culpability there. So this isn't, it's not where we're just going to go for the person that's dealing at the lowest level in the street. It's going right after, big corporations. And that's frankly the only thing that's going to be effective if certain poisons are not put out there or misprescribed or misused by the medical profession. That will help. It's not the only solution to the problem, but it certainly has to be done.
Anybody else from the audience?
Good evening to everyone. My name is Patricia Gadsden, and I'm with Life Esteem. Life Esteem happens to work directly and very closely with the County Department of Drug and Alcohol Programs, where we provide 2 programs specifically addressing this issue for families. One's called Celebrating Families, which is a 16-week program where the entire family goes through this specific educational 16-week program from 3 years of age to adult. Because it was expressed earlier, unfortunately, this epidemic is not an individual epidemic, it's a family epidemic, and everyone in that family is impacted or affected in some way. And what we do is allow that opportunity for that family to come together and really work through and see how they can move forth, and through what we call the healthy living circle that has to address the physical, mental, emotional, and spiritual aspects of what's necessary and needed for a family to be a whole unit. And this is something I think could definitely be more available to more families to really go through this process. Also, that particular program that Deputy Chief Booty just talked about actually was the Systems of Care that was held about 2 years ago. Mm-hmm. And we got a number of young people in the community to help put that on. It was extremely effective, and some of the feedback we got from some of the young people that came from various parts of this county was tremendously, really wonderful program. Another thing we do through Pennsylvania Recovery Organization Alliance, which our Joyce Vanderhorst also went through, was our Certified Recovery Specialist training, where we take individuals through 10-course training to become certified recovery specialists to work with individuals that are in their recovery path. And which is so nice about that is that most of these individuals themselves have been in recovery for some period of time. And it works somewhat similar to a warm handoff type of opportunity. And a lot of those folks here in the county that are doing warm handoff are the certified recovery specialists. So we do have things that are happening in our community. It just needs to be more, publicized, and to get more and more families engaged and involved. And I just want to let people know that there are things that are taking place.
Thank you, ma'am. Thank you.
Thank you.
Any other questions from the audience, please?
Hello, I'm Gloria Merrick. I'm the Executive Director of the Latino Center. And from a cultural perspective, I'm wondering what are some of the things that you're doing to engage the overall community in terms, I know that there's a greater increase with blacks and Latinos utilizing opioids since 2016. So has there been given any thought to how we can have more culturally competent and increase access to care for those populations?
Anybody want to take on that question from the panel?
I mean, I can start it with just what we're doing right now. Step one, from a police department standpoint, and again, we're limited to just from the law enforcement side. Obviously, we don't direct past the medical side, the EMS side, and the trained professionals. But even from a police officer standpoint, our big piece with even our own people are education. And I keep hitting on this education thing because it is extremely important for us to provide that level of service where we get past the old mindset of that's just an addict, this is just a person doing this because they want to do it. We now know that it's much bigger than that. People aren't doing it just because they want to do it. They're trapped in there. It's a disease and they're trapped. So the piece from at least the police side is bringing our own staff up to par. And it's challenging in the sense that we talked about this and this came out before. What police are required to do now, the list just keeps getting bigger and bigger and bigger. More things on our shoulders. So that balance with the young officers of just saying, here's the important piece of it. Here's where we start. This is where we take our foothold and then move from there. So for us, when we are truly at that place where we need to be, and it's happening. I have officers in our employment that are very passionate about the overdose or people that overdose, that actually go out and carry extra cans of Narcan. We distribute them out to the cars. We got our training level up so that the officers all know how to administer. That was step one for us, learning what to do, what signs to look at. And then we have some that have really taken off with it, that just, they believe that, this touches all of us. And when I talk to the officers, again, we don't get to pick and choose what we do, but some are very active about going back into the community because they believe, everyone deserves a second chance. And if I can just save one, that's one step closer. In regards to just specific targeting of different backgrounds and different cultural settings, we're not quite there yet. We're looking at it at just a general, overall, everyone is equal in this. I will say from our numbers, though, and not to make this a big deal, we do tend to see white males in the 30 to 40 range. That's our overdose numbers that seem to be the highest population right now. So I just throw that little nugget out there, but we're keeping it at this point as just a general. We will get to specify as we learn our own little techniques and how we can close doors. There are little loopholes that are open right now that we think we need to close, but that's the approach that we're taking.
Just follow up on that. I just want to invite you to the Latino Center if you're interested in conducting focus groups or talking with our population in terms of, what are some of the different ways that perhaps they can be engaged and some of the ways that they can perhaps find the help that they need for their individuals and their families that need the help, because we get, like Pat said, it's about the families. We get the moms and the dads coming in talking about their sons or their daughters and the issues that they have. And so, utilizing some of the programs that Pat has, but then also looking at exploring at the different centers, community centers, what are some ways we can engage those different pockets within the communities. I just welcome that opportunity.
Right. And I would just add, as Deputy Moody was talking, that going forward, what we will do is meet with you to be able to see what the need is and develop programs to address that need.
Any more questions from the audience?
Good evening, everyone. My name is Gabriel Oliveira. I'm a captain with the Harrisburg Bureau of Police. One of the things that was mentioned several times was education. There is a national need for that education. There's a state level need for that education. But what kind of education can we bring locally that the community can bring to the individuals that they see day in and day out?
I think what you've heard this evening almost partially answers that. I would say the difference between the crack epidemic and the opioid epidemic, when crack hit the streets, there's a lot of media attention. Some laws were even changed for mandatory sentences. There was somewhat of a focus, but it wasn't altogether successful because that epidemic was still viewed as just a city problem. It truly was. This epidemic's a lot different. Most people that you speak to at a professional level acknowledge that it's not just a city problem. And just from what we heard with the various community members that got up that have different programs, whether through the county, through church, through a social organization, that was not done 30 years ago. And I think there's probably no like magic, program that's going to resolve everything. But I think depending on your community, what you feel your community needs, and whatever program you decide to have has to be tailored to your particular community. Even though all the communities basically have the same issue, sometimes things are dealt with differently, and that goes across cultural lines. So I think the positive thing that's come out of tonight is hearing some of the things and some of the programs people already have going. And like the deputy chief said, not doing nothing is obviously going to fail, but it seems to me that the only positive out of this opioid crisis that I have seen is the fact that more people are working towards solutions. So I think, that shows that there's definitely a ray of hope.
Okay, thank you for that. And does anybody else have any more questions?
My name is Gina Reardon, and I'm the program supervisor for Drug Free Workplace PA, which is a PCCD grant. And we travel all around the state, and we provide exactly the education that you've been talking about with churches, organizations, and all workplace. It is all free. We have been in well over 1,000 workplaces, churches, and organizations. And this grant has been in existence for almost 5 years. And the Latino community, we actually just did an article for the Latino Business Journal, and I was going to reach out to you too because we actually do have a translator.
That'd be awesome.
Yes. Okay.
Thank you.
Thank you. Focusing attention back to my panel. And I really hate proposing this question, but I have to do it. When it comes to any sort of epidemic, any sort of serious problem, there's always a money issue. And we have to, let the people know, that we're all in. So who can speak on that as to being all in and money is not a problem?
I'll speak for a moment about some of the funding that we're going to be seeing, and actually some of it is literally hitting right now.
Okay.
So there are two grant streams. One's through the CDC and the other one is federal as well. One is coming to the Department of Health and the other one is coming to DEDAP, which is Drug and Alcohol Programs. I believe combined they are between $20 and $30 million. We've seen federal funding before, not to this degree. And so it allows us more flexibility in regard to some of the programs, whether that's the PCCD program that the young lady actually just focused on, thank you, or even additional naloxone or educational programs. And so some of our challenge right now is to take that money and say, how can we turn that money into usable deliverables? That's the challenge we're going through right now, but we are seeing that funding, and we're going to be seeing some of that funding literally for the first time. Some of it we've had, some we're seeing for the first time literally this month in the Commonwealth. So, but even with funding comes challenges, and I know we all know that. So we are looking at all of the things that we've had to learn with the governor's 3 disaster declarations up until this point, with the unified effort with all of the state level agencies, and with gaps, with areas where funding could have made a difference. We're looking at those areas now and saying, now we have the money, now we can fill in those gaps.
Mrs. Sponnyberger, how about the county? What is the county's view?
I know that we do the best we can with the money that we receive. We receive money from the Department of Drug and Alcohol Programs. We have a grant with the Pennsylvania Department of Corrections. We're looking for money everywhere we can. And I know Commissioner Hartwick is always looking for money that we can use for the individuals in Dauphin County. I'd just like to add that moving forward, one of the things that Captain Oliveira talked about is education. And then I heard of designing that to address the needs, and that's what we need to do, and that's an initiative I'm certainly open to developing, that we talk to you about, okay, well, what would help your officers? What do you need to know, rather than what we always do before. Well, we do this one program, and that's it. So we will talk with you as well. So.
I personally want to thank you because I know that you've been in contact with my deputy chief. You came to our supervisors meeting and you enlightened us about a couple programs that you do have, and I thank you for that. And I think that the collaboration between our two agencies will turn out really, really big when it comes to this opioid crisis. Chief, what can you tell us about the funding that the generals are dedicating to this here crisis?
If you just consider Dauphin County has approximately 23, 24 municipal police departments, some of them with as little as 2 or 3 officers, and then Harrisburg City that has well over 100. And smaller departments don't necessarily have the funding to even do drug investigations and or equipment to do those. Where the Attorney General's office, my region covers a 9-county area, and we supply not only manpower, agents to help with operations, but equipment as well. To give an example, we had one earlier this year in Harrisburg City. It was a nuisance property in the middle of a street, constant flow of traffic in and out, vehicles pulling up all hours of the night. And that clearly was a quality of life problem for that neighborhood. Now, these weren't people that were dealing, 100 kilos of cocaine, but what they were dealing was enough to be a nuisance in a neighborhood. We were able to charge them federally, and that can be very costly, but to no cost of Harrisburg City. We put a lot of overtime with our agents, but when we do an investigation, we don't give a bill to the local jurisdiction. If we're paying the overtime, we have some grants that we use in different parts where we'll pay all the overtime for that particular police department, which allows them, even a smaller department, to do an investigation. Because most cities, boroughs, townships, they just don't have unlimited amount of funds to do any kind of investigation. And that's where we've come in frequently.
Thank you for that, and on behalf of Harrisburg City, I personally want to thank you in the general for everything that you are doing and the collaboration that we have done so far in fighting the opioid crisis. Gentlemen,
Yes, sir.
that's our time. I'm Thomas Carter, Commissioner, Harrisburg Bureau of Police, and I'd like to thank my panel, Chief Sadler, Mr. Barshinsky, Mr. Sponnyberger, and Chief Moody. On behalf of Harrisburg City, our great Mayor, Mayor Pappenfuss, we want to thank Governor Tom Wolf. We want to thank the General for all that he's done for us. We want to thank Commissioner Hartwick, sir. And Chief, thank you for the service of you and your young force. Studio audience, I also want to thank you for the questions that you asked the panel. Thank you very much.
Thank you.
Thank you.